So one controversial thing, Hahnemann has said single, simple, similar. Now if you go, especially Schwabe or any other company, you will see whole range of cocktails.
Right.
So some homeopathy doctors are happy with it. So they just want to take the off the rack and prescribe something and send it away. Some homeopathic doctors are not liking it. So what's your thought on it?
Right. Yeah. Number one, I would start with the concept what Dr. Hahnemann you have raised up. Then I would move on to the current scenario. Number one, Dr. Hahnemann himself changed his concept at least 6 times. What we know, right, in 6 different editions of Organon, because he believed that every science need change. Evolution is must for that. And if you have read the Peter Morrell's article, Peter Morrell, who did researches on the case sheets of Dr. Hahnemann, who himself and another scholar, I'm forgetting her name, they did a lot of work on that. They took the case sheets of Dr. Hahnemann during the last phase after the 5th edition of Organon, after particularly 1935. And they have written a complete article on that. Interesting facts, what he found was Hahnemann used more than one medicine during his last phase of life, and Hahnemann used multiple repetitions of the doses during those periods. So what we have, there is one idealistic Hahnemann, there is an experimental Hahnemann. So what we have been sticking into still is with the 5th edition of Organon, idealistic Hahnemann, and we haven't seen that experimental Hahnemann. What Dr. Hahnemann had said, had he been alive for furthermore 5-10 years more, maybe he might have come up with some guideline how you can use combination medicines or how you can repetition. Even in the 6th edition, he with LM potency he admitted, he put that we can use repetition with LM potency. So maybe some more further ideas he might have thrown up. That is number one. Number two, if we look at Drugs and Cosmetics Act, combination is also part of Drugs and Cosmetics Act, and legally it is allowed. Okay. Number two. Then number three, I was just referring to Dr. Praveen as my first encounter with him. That presentation was on combination.
Okay.
He explained a scenario. Even though he was following single remedy, there was an incident where a patient was having some emergency and he could not have time to take the case and choose the remedy. So he had given 4 medicines and asked her to take one after another in half an hour interval or something like that. But at the end of the day, she was fine. So he said that I don't care whether this worked or that worked, but my patient got the relief. That is the thing. So similar scenario today we are facing much more than Dr. Hahnemann's time. I mean, patient want their cold and cough to be relieved with only a single visit. They don't want to again and again come every day to visit the doctor. So you have to give in the first phase either Allium cepa or Argentum nitricum. Then for the second phase, it could be Pulsatilla, it could be Calibec, it could be Antitot, it could be Spongia or Drosera. So you have to choose those medicines. I generally give Antitot and Calibec alternately. After 2 days, you take Argentum nitricum today or Allium cepa today, whatever. Then from tomorrow or day after tomorrow, once this acute phase is over, the running nose and sneezing is over, when it becomes mature cold, then you take Antitot in the morning, Calibec in the evening, something like that. I give. So many people what do, I don't combine the medicine, single remedies, but many people other doctors, instead of giving alternately, you give Antitot, Calibec in one vial and give it. Okay, that is also okay. They are saying that it is working fine. That is also okay. And as a manufacturer, it's a kind of a restaurant, right? And a restaurant, or I mean, it is a service and product providing organization. And a good organization which is providing any product, whether service based product or physical product, it is their obligation to provide them, cater across the sections, across the consumer segments, binding with the legal framework, right? So as an organization, yes, if you are a single remedy manufacturer, then okay, I'm giving best quality of single remedy. If you are a combination user, then I'm giving combination. Whatever you want, you choose and you take, and we don't force anyone to follow this method or that method. That is another point. I was given by a principal, in fact, a vice chancellor of university, homeopath, that he was happy to see that there are some homeopaths who also practice maybe other OTC medicines apart from homeopathy, other OTC medicines, whatever available in the market in rural areas, to fill the gap of lack of doctors in that particular area. They used to get from the nearby medical shop allopathic syrups, whatever they are getting. So they started using homeopathy because of these formulations. If you have a cough syrup, for example, alpha cough or 216 Shawbase alpha cough, if they are getting it, they are replacing with the allopathic medicines.
Okay.
So if they could be able to provide with these formulations, replacing a side effect medication with a side effect free medication, then why not? It serves the purpose of reaching more people, safe medicine. So that is good for the society as well as for the homeopathy.
Right. So definitely homeopathy medicines, even in combinations, are more safer than allopathic medicines, and also more efficient than allopathic medicines, whether it is single remedy or
Right.
multiple remedies.
Right. True. Yeah.